Hi everyone, I'm Devanshi and today I'm going to revise with you pediatric COMA scales. So basically this topic is a part of the unit critical care medicine and there are three scales that we are discussing. Basically, where do we use these COMA scales? Whenever there is a very critical ill patient in our OPD or emergency OPD, whenever the patient is unresponsive and the patient is not breathing. So what is the BLS algorithm like? It is A, B, C, D, E. So there is airway, there is breathing, there is circulation, there is disability. So after assessing the airway, breathing, circulation, after we have managed that, then we come to the disability part of the algorithm. And in the disability part, we are assessing the mental status of the child. So that is where we use these pediatric COMA scales. There are three scales that I'm discussing today. The standard one is the GCS. We have a pediatric version of it, that is the modified GCS that I'll be discussing. Then there is a simpler scale, that is the AVPU scale, and then there is a more elaborate scale, that is the 4-score scale. That is the full outline of unresponsiveness. That is that scale, which is the most elaborate one. So first I'm starting with the AVPU scale. So what is this scale? There is it basically assesses the baby on the basis of how responsive the baby is. If the baby is alert, awake, and spontaneously the baby is responding without any stimulus, then it is said to be letter A. Then that baby is given letter A. If the baby is responsive on verbal stimulus, then V, painful stimulus, then P, and then unresponsive, that is the U, that is the worst response. So basically AVPU scale does not have its own score. You have to relate it with the GCS score. So we can tell the range of GCS score. We will not able to tell us exact score. It is kind of an indicative and a ready to use scale. So if a baby is alert, that is he has been assigned A, then he will probably lie in the GCS score 15 or 14. If the baby is responsive on verbal stimulus, that is the V, then he will probably lie in the range of GCS 12 to 13. If the baby is responsive to painful stimulus, then probably the baby would be GCS less than 8. An unresponsive baby would probably lie in the GCS 3, or that is the worst case scenario. So that was the AVPU scale. Definitely you can understand that it's a very least elaborate and a very ready to use kind of a scale. It is usually used in patients who have altered mental status. Then we are coming up to our standard, our very own GCS scale. So the pediatric version of this GCS is basically, common sense modification. And like for example, in the I response, if the baby is an infant, if the baby is less than 1 year, then definitely you cannot assess the baby on the basis of verbal command. The baby will not open his eyes if you have called out his or her name. So you cannot elicit I response in a pediatric patient less than 1 year with verbal stimulus. So you have to shout or you have to produce like a very loud sound stimulus. So like these kind of changes, or the changes are like that. In the motor response, the best response is obedience in a pediatric patient. So if a baby is less than 1 year, you cannot elicit any obedience in the baby. So there is spontaneous movements. That is the best score. Then we have in the verbal response, what are the changes? Verbal response में उन्होंने उसकी basically उसकी utility को बढ़ाने के लिए they have done 3 sections. One is the assessment of verbal response in a less than 2 year child, then 2 to 5 years, and then more than 5 years. So orientation as the best response can only be elicited in a child who is more than 5 years. Then 2 to 5 years, there are definitely that is word response. 2 to 5 years में ही आप word response elicit कर सकते हैं, like appropriate words or sentences or inappropriate words. Then in the less than 2 year baby, you cannot elicit any word response, like words नहीं बोल सकता वो. Then so these are kind of the common sense like changes. So this was the GCS scale. GCS की interpretation आपको मालूम ही है, just less than 8 पे हमें we have to think of the assisted ventilation. हमें less than 8 पे intubate करना पड़ता है बेबी को. Then we have the 4 score, which is the most elaborate of them all. And what are the advantages, or what are the superiority over the GCS scale in the 4 score? 4 score is basically full outline of unresponsiveness scale और इसके टोटल स्कोर होता है 16, जो कि GCS में 15 था। तो इसके अंदर 4 कंपोनेंट्स होते हैं, द आई रिस्पॉन्स, द मोटर रिस्पॉन्स, द ब्रेन स्टेम रिफ्लेक्सेस एंड द रेस्पिरेटरी पैटर्न। सो इसके जो 2 एडवांटेजेस हैं, वो सबसे पहला है दैट दे हैव इन्वॉल्व द ब्रेन स्टेम रिफ्लेक्सेस। तो इससे हम पेशेंट का कॉर्टिकल फंक्शन, हम उसका ब्रेन स्टेम फंक्शन भी, हम नॉट जस्ट द कॉर्टिकल फंक्शन, हम उसका ब्रेन स्टेम फंक्शन भी असेस कर रहे हैं। उसके बाद रेस्पिरेटरी पैटर्न, जो सबसे मेन जो GCS की एक डिसएडवांटेज मानी जा रही थी, दैट वी कैन नॉट असेस द वर्बल रिस्पॉन्स और वी कैन नॉट असेस एन इंट्यूबेटेड पेशेंट बेसिकली। तो इन्होंने इंट्यूबेटेड पेशेंट में भी उसे असेस किया है, विच आई एम गोना टेल यू। तो मैं 4 स्कोर स्केल को, क्योंकि ये एक नई चीज़ थी, मुझे भी नया लगा था व्हेन आई रेड इट, तो मैं सबसे ज़्यादा इलेबोरेट करके इसे बता रही हूँ। आई विल एक्सप्लेन द स्कोर 4 से लेके 0 तक। So first thing, that is the eye response. What is the best response? 4. Eyelid open or opened, tracking or blinking to command. जो इन्होंने tracking को, like the child will track with you, that is tracking. Then score 3 is eyelids open but no tracking, spontaneously open. Then score 2 is eyelids closed, open to loud voice, not tracking. Score 1 is eyelids closed, open to pain, not tracking. एंड 0 इज eyelids remain closed with pain. मोटर रिस्पॉन्स में बाकी की चीज़ें सब सेम है, लेकिन जो बेस्ट रिस्पॉन्स है दैट इज़ 4, दैट इज़ थम्स अप, फिस्ट और पीस साइन. सो बेसिकली मोटर रिस्पॉन्स में बेस्ट रिस्पॉन्स वो कैसे एलिसिट करवाते हैं, दे विल टेल यू टू मेक अ पीस साइन, अ फिस्ट एंड अ थम्स अप साइन, ऑब्वियसली विच कैन बी एलिसिटेड इन मोर देन 5 years. उसके बाद सारा कुछ सेम है. ब्रेन स्टेम रिफ्लेक्सेस में प्यूपल एंड कॉर्नियल रिफ्लेक्स प्रेजेंट है या नहीं है उसके हिसाब से है. और जो सबसे मेन चीज़ है दैट इज़ रेस्पिरेटरी पैटर्न. तो इसके अंदर जो स्कोर 0 है और स्कोर 1 है दैट इज़ फॉर इंट्यूबेटेड पेशेंट्स. स्कोर 1 इज़ व्हेन द इंट्यूबेटेड पेशेंट हैज़ स्पॉन्टेनियस ब्रेथ्स, दैट इज स्कोर 1, दैट इज़ अ बेटर प्रोग्नोसिस. और 0 स्कोर का मतलब है इफ़ एन इंट्यूबेटेड पेशेंट डज नॉट हैव एनी स्पॉन्टेनियस ब्रेथ और द पेशेंट is breathing at the set ventilator breathing rate. मतलब अगर वेंटिलेटर की 40 है तो बेबी की भी 40 है. So that is how they have judged the intubated patient on the basis of spontaneous breath, respiratory drive is present or not. So 2 इसके एडवांटेजेस हो गए. एक तो उन्होंने ब्रेन स्टेम रिफ्लेक्सेस को भी इन्वॉल्व करा है और दूसरा उन्होंने रेस्पिरेटरी पैटर्न को भी इन्वॉल्व करा है. Like 4 score is in a non-intubated patient, regular breathing pattern, that is the best response. 3 is Kane-Stokes breathing, 2 is irregular breathing, then 1 or 0 is for intubated patient. Brainstem reflexes में pupil और corneal reflex हैं. तो these were the 3 scores. I hope you like this video and do give it a thumbs up if you do so, and for more such videos subscribe to my channel. Thank you.